On the eve of the release of a parliamentary report into Australia's immigration detention network, Lateline has been told of shocking instances of suicide attempts, drug overdoses and self-harm at a Darwin detention centre. A doctor who's worked at the Northern Immigration Detention Centre says he feels compelled to speak out because at least one person a week is trying to take their own life. Many more are inflicting self-harm, and most detainees are on prescription medication for insomnia and depression. And Amy Bainbridge has this exclusive report.
Darwin's Northern Immigration Detention Centre is the temporary home for 116 men. One doctor who has worked there says the NIDC is like a prison for detainees, and there is a communal sense of hopelessness. This doctor is speaking out, but to do so has disguised his face and asked us not to reveal his name or use his true voice.
A lot of them say, I'm depressed, I can't sleep, I can't eat, I can't find motivation to exercise or learn English or do anything constructive. But a lot of them, in terms of the most severe people, have asked me to end their life. After 6 to 12 months, most people have attempted some sort of self-harm, either due to complete loss of hope or because they hold on to the small hope that that might lead to a faster end to their detention.
He says many detainees starve or cut themselves, and many attempt hanging or to overdose on drugs. The drugs most commonly prescribed are for depression, psychosis and insomnia.
Normally they'd get 1 week's supply at a time. If you know other people and you're able to ask, can I have your tablets? Can I have one of your tablets? In time, you can collect quite a lot.
There are many stories of self-harm. This is one of the most disturbing.
I'm aware of it. A gentleman was in a room with the health staff and he stood up and apparently took out a light bulb and chewed it in front of them as a measure of desperation to show them how upset he was at his continued detention. This is the second time he's done this in a month, and both times he expected to die as a result of it.
This doctor is speaking out because he's deeply disturbed about what is happening inside the detention centre.
It's not too late to stop this. It's untold damage we're doing to thousands of people every year who enter this country. 90% plus are found to be refugees, and that's after sometimes 2-3 years in detention. And they bear the scars of detention, all of them. Some of them are physical, but most of them are mental scars.
As many as 5 detainees a day from Darwin's 3 detention centres are sent here to the Royal Darwin Hospital.
Many of the patients present with some mental health problems. They may be chronic anxiety, depression, and many are on antidepressive medications. Some are presenting with psychiatric illness and require admission to our psychiatric ward. Some are presenting with injuries from accidents. Some are presenting with injuries from self-harm.
The AMA says it's putting enormous strain on medical staff and resources.
We have a policy which is foisting unfortunate detainees onto us. The other frustration is the fact that once we recognise the mental health issues and once we're able to exclude organic pathology, we are immediately sending these people back to exactly the same lock-up facility.
The Immigration Department has told the ABC,
we try to ensure people remain in detention for as little time as possible and ensure that they are treated humanely and have appropriate access to health and mental health care. We have introduced new mental health policies and expanded mental health staffing. We have a psychological support program which is in operation for all people in detention.
The latest information detailing the severe mental health issues among detainees comes on the eve of a parliamentary report into the nation's immigration detention network. The inquiry has received more than 3,500 submissions.
It is a system that is inherently broken. The government needs to act and needs to act on the recommendations in this report.
The committee has examined the reasons for riots and the length of time detainees have been held in the detention network. Amy Bainbridge, Lateline.